Right, so hello everybody. Thank you so much for joining us this afternoon. We are absolutely delighted to be here and to be sharing the Unpaid Care Dashboard. In a few moments' time, I'm going to hand you over to Dr. Maria Petrillo. She is going to talk you through the origins of the dashboard and do a very thorough demonstration for you of how this can be used and different techniques you can use within the dashboard as well. We've just got a few more people coming into the waiting room, so bear with us. So in the meantime, I would just like to introduce myself. My name is Faye Benskin. I am the impact specialist for the Centre for Care. In a moment, Maria is going to explain a little bit more about the Centre for Care and what we do. Bear with me. Sorry, we've got more people coming in. Maria, I'm going to hand over straight to you because I don't want to delay at all. And I know there's a lot for us to cover. We have scheduled an hour for this. We're going to invite questions at the end, but please feel free. Do pop any questions in the chat as we're working through the presentation, and we'll address them right at the end. And there'll also be the opportunity for you to pop your hands up and speak and share any of your reflections and insights as well. So without further ado, over to you, Maria. Thank you.
Hi, everyone. So first of all, can you see me, hear me all right? Can you see my slides? Everything?
Yep. We've got you. Thanks, Maria.
Perfect. Good morning, everyone, and thank you so much for joining us. I'm Maria Petrillo, and I'm a research associate at the Centre for Care. And today, I'm very excited to introduce the Centre for Care Unpaid Care Dashboard, which is a collaboration between Professor Matt Bennett, University of Birmingham, Tom Siddle, University of Sheffield, and myself, as well as partners at Carers UK and South Yorkshire Integrated Care Board. This work has been co-developed with the invaluable input of unpaid carers, care sector professionals, and people with lived experience who helped us ensure that the dashboard is not only rigorous, but also relevant, accessible, and user-friendly. So, before diving into the dashboard, let me briefly tell you about the Centre for Care. We are a 10 million ESRC research center. We are passionate about using large-scale data to better understand care and caring, and crucially, to tell stories that reflect real people's life. We focus on care in its broader sense, the support that enables well-being, life chances, and inclusion in everyday life. That includes paid and unpaid care across the life course. Our work is interdisciplinary and also collaborative, involving several universities, University of Sheffield, Birmingham, Oxford, Kent, and London School of Hygiene and Tropical Medicine, alongside also major policy and practice partners like Carers UK, the National Children Bureau, Office for National Statistics and the Social Care Institute for Excellence, and also many more. Our research is structured around three core groups, which are care trajectories and constraint, inequality in care, care workforce change, as well as four cross-cutting themes: care as a complex adaptive ecosystem, digital care, care data infrastructure, and children and families. Now, today, dashboard comes out of work led by the Inequality in Care group and the Centre for Care, Care Data and Infrastructure team. Now, first, before jumping into the dashboard, let me take you back where this journey began. In 2023, we worked with Carers UK, so the Centre for Care worked with Carers UK to publish a report called Valuing Carers 2021, England and Wales. And in this report, we try to estimate the economic value of the care provided by unpaid care using census data 2021 and 2011. Our estimation says that the care provided by unpaid care is worth an estimated 162 billion per year, and this represents a 29% increase since 2011. And just to put this into perspective, 162 billion per year is roughly equivalent to a second NHS. Now, that figure was captured nationally, and I have included in the slide some media information, and was also used in policy and practice debate. But the report also provided valuable information and resources, including, for example, an explanation why we see this rise in care value, And most importantly, it includes also lookup table at local authority level, highlighting the significant inequality at geographical level. So that got us thinking, what if we could take this data and make it dynamic? What if we create a tool that will allow people to explore unpaid care in their own communities using robust census data and help them to tell their own stories? And that's how the Unpaid Care Dashboard was born. Now, we know that census data play a vital role in shaping policy, allocating local government funding, but also driving academic research. And we know the census data offer rich insight into topics like aging, demography, education, ethnicity, labor market, gender identity, and so on. So we realized, what if we could use all this breadth of information to really understand unpaid care, not just in general, but by place, by time, and by social groups. So as a team, we are also very proud of the fact that while the Office for National Statistics made a number of tables and data sets available, we went a step further. We commissioned entirely new tables, information that haven't been previously published or accessible. For the first time, this new data asset provide a deeper intersectional view, so it takes in consideration all sorts of characteristics of unpaid care across England and Wales over time and geography. Crucially, we brought all of this together in one single place, this interactive dashboard, a tool that is designed not just to showcase the data or to do fancy graph, but also to help people explore data on unpaid care. So at the bottom of my slide, you can see the summary of those new commission and bespoke table. So for example, we commissioned table including breakdown of unpaid care provision by age and sex across the following key characteristics. For example, long-term health problem or disability, ethnic group, general health, religion, marital status, and so on. All of these is made available at local authority level for 2011-2021 and fully visualized in an intuitive and interactive dashboard. Now, we didn't do this alone. From the outset, we committed to co-design. We ran a series of hands-on workshops with around 40 stakeholders, including carers, ICB leads, commissioner, national charities, and advocacy groups. We asked what mattered the most to them, what information they need, how they want it to be presented, what terminology is right, and even what color scheme is more accessible. We tested the early version of the dashboard and we then iterated the dashboard to respect those feedback, to incorporate this feedback. That process has helped to shape a tool that is usable for advocacy, commissioning, scenario planning, grant application, and it's worth mentioning that this is also screen reader compatible and also is supported by material provided also in Welsh. This is to secure accessibility and inclusion. So one might ask, okay, what this dashboard help us to understand about unpaid care? And let me give you a summary of what we can explore via the dashboard. So first of all, the dashboard confirms some important national trends. For example, more people are providing more hours of care than ever before. In 2021, around 8% of the population in England and Wales identified themselves as unpaid carers. But those are things that we all know. It was like main, key message from the census when the census came out. But the dashboard allow us to dig a little bit deeper. For example, through the dashboard, we can see a clear relationship between higher hours of care provided and the general health, in the sense that more hours of care are provided per week, the worse is the general health reported by individuals. Another relationship captured by the dashboard is also the high-intensity carers, which we define as those carers providing more than 50 hours per week of care, are less likely to be employed and also less likely to have, more likely to have no formal qualification. Female carers, for example, particularly if we consider high-intensity female carers, appear to face the most pronounced disadvantage in employment, and working carers are more likely to be employed in flexible and family-friendly sector, highlighting what we already know, that unpaid care struggle to balance paid work with unpaid care work. Now, the dashboard are also allowed to tell some powerful regional stories. For example, in the South Yorkshire, where the University of Sheffield is based, the value of unpaid care rose from 3.17 billion in 2011 to 4.03 billion in 2021. And this is 27.1% increase. In Inner London, the increase was slightly higher at 29.8%, growing from 4.19 billion to 5.44 billion. Now, because we really aim as a center to be as inclusive and as accessible as possible, to support the use of the dashboard, we developed several resources. This includes webinar and workshop as this one, and we are really happy to offer to your organization or team a customized one, short animation and explanation video available on the dashboard website, which I'm going to show you just in a second, guides and tutorial, which are available, as I said before, in English, but also in Welsh. Everything we build is open access. There is no registration, no paywalls, just freely available data and visualization that you can use immediately. And to reinforce that, we also made it easier for you to customize your visualization of the dashboard and download directly and request directly, the data and visualization you are interested in via an Excel file or a PDF format. You'll get it sent directly in your inbox with an automated email. The only thing we really ask is that you cite the dashboard whenever you use visualization or data from the dashboard, because these will really mean a lot to us. It will help us to track impact, to understand the usage, and to improve the dashboard even further in the future. So we really hope this dashboard becomes a powerful tool for you, whether you are a policymaker, a career advocate, a charity, a commissioner, or a researcher. This is just the beginning. We are seeking feedback to improve the dashboard further, and we really would love to hear your feedback after this presentation. So the big question is, how do I access this amazing dashboard? So let me go and share with you how you can actually access the dashboard. So I will stop sharing the screen, and what I will do is to share this other side on my screen. Can you see the Google page?
Yep, that's there, Maria, thank you.
So all you need to do is Google Centre for Care, and here on the first page, you will see our amazing website. If you click on it, you will go on the landing page of our website, in which you can find information about the wider work the Centre for Care is doing every single day, whether it's our quantitative network, whether it's our commentary, publication, or even just background information of the Centre for Care. But most importantly, in this presentation, we also have a tab that is called the Unpaid Care Dashboard tab. If you click on it, this will lead you to the landing page of our dashboard. So if you want to do, I can see now that in the chat, the link has been included. You can tag along. We can play with the dashboard together. So feel free to just start Googling. So in the landing page, first you will find a summary of information. I'm not going to go through this because I already provided some background information in the presentation just a few minutes ago. But here you will see why the Unpaid Care Dashboard is important. It will provide also a little bit of a description of the pages that I'm going to show you in a while, and that can basically constitute and make up the entire dashboard. We also, as I said, provide some animation, some beautiful animation made in collaboration with the colleague at the Nifty Fox, which really bring the dashboard into life. So the animation on the left-hand side here provides a little bit of explanation why the dashboard is important, why we started this project, why we think it can be useful. While on the right-hand side, you will find a tutorial that is mainly hands-on the dashboard, and it will allow you to explore the different features of the dashboard, all the components of the dashboard to better understand how to use the dashboard. but also we have some comics here, whether it's in English or also Welsh. The first comic, let me open it for you. Can you see the comic here? Can you please confirm that the page turned to the comic? Yes,
that's
perfect. So this first one, again, is a summary of why the dashboard is important to us, what little statistics about unpaid care, little data that we already know, and why we need to understand and to have better data to fully capture the importance of unpaid care here in the England and Wales in particular. The other comic provided is this one here, and this is really a tutorial on how to use the dashboard. So if you scroll it down, you're going to see a little bit of information about the dashboard to then jump into how we use the dashboard. There will be some screenshot of the dashboard here, an explanation on every single page you're going to see, how to filter your data, instruction how to filter, how to select different filters, what is an icon, an explanation box, what can you find information about the data that we are providing, and if you need help, what to do, if you want quick numbers, what to do, and so on. I'm going to explain this all in just a second. If you scroll down here, you will see a little bit of the co-design approach. Again, I already went through the co-design approach that we adopted, but here you will see some quotes from the people that were actually involved in the co-design, explaining why they found it useful, how we collaborated with them, in which way they see the dashboard being useful for their case. And then we have some citation here. Again, if you can use the citation, that will really mean a lot for us. This is the way you can cite the dashboard, a little bit of information about the data, and the acknowledgement, including also Tom Siedel, that help us in creating this amazing dashboard with Power BI and Python. So let's go to the main page of the dashboard. As you can see, it's fully incorporated in the website. It's just here. You can use it. You can directly jump in. And what you will see, first of all, is our welcoming page. Now, the welcoming page includes a summary of the project, our partners, the background of our work. I'm not going to go over these in detail again because we already did that in the slides. But here there are useful links like the link to our report, how to contact us, information about the author, the citation again, and some useful link to the website of our partners. Now, if you want to go to the next page, you have two options. Either you select it from here, you just press the arrow here. So the next page is the data request tool. Now, the data request tool is one of the best features of the dashboard, I believe. What you can do here is to actually commission data and visualization directly from the dashboard. And all you need to do is to fill out this form. Now, let me click on the form. Please, Faye, if you can confirm that you see the form, that would be useful.
Yep, that's worked.
Okay, and as you can see here is a very simple form. There are 7 tick box questions. The first one asking your email address, so the email address to where you want to receive the data. Then the first question is which visualization of which page you are interested in receiving, which data you are interested in receiving. That you can select, for example, the local authority that you want to analyze, or you can select more. You can select all of them. You can select all. You can select everything you want to receive. We scroll down to the very long list of local authority that we have in England and Wales, and we end up to the other question. The other question is what kind of information you really want. Do you want information about those who do not provide care? Do you want information about those providing care from up to 19 hours or from 20 to 49 hours or more than 50 hours? Or maybe you want all the unpaid carers, and that's fair enough. You select the year, you select the age range, you select the sex, and that's just a question about what sector you're working in, just to understand how to better tailor the dashboard. Okay, I will close now the form. Again, the form can be found here in an accessible way directly on the dashboard. And we can go to the help page, which is our next page on the dashboard. Now, Our help page provides a little bit of information on the functionality of the dashboard, how to get it started, and we link you directly to the video that we provide, the comics that we have realized, that we have created. So all information are here, the license of the data that we fall under, everything really. And it will provide you some instruction. For example, if you want to select multiple local authority in the filter that I'm going to show you in a while, please hold down the control button that you have on your keyboard. Just this little feature that you need to know in order to use fully the dashboard. But let's cut to the chase and let's go directly to the very first page of our dashboard. It looks exactly like that. So here you have a map of carers. Here you have on the left-hand side all the filter that you can select. So here is the district filter. Here is the hours of care filter. You can scroll down and select the care intensity you want to analyze, year that you want to analyze. We have sex, the age range, and every time that you press a filter, for example, let's say we want to focus on Amber Valley, and then we want to focus on the female gender, female sex, all the summary of the filter that you have selected will be shown here. So again, here in this district, we have selected Amber Valley, sex female, and all the data are actually related to those two selections. In order to clean the filter that you have selected, if you scroll here, you will see this little icon that will clear for you all the filters selected. Now, for the quick stats, what can we see in the dashboard? Well, we can see in the number and value of unpaid carers, you can see that under 5 million out of almost 60 million of people are providing care. You can see the nominal value, and you might wonder what is the nominal value. Well, you go on the right-hand side in the box, and you will find exactly the description that we give to that term. So in our case, the nominal value is the monetary value unadjusted for inflation, showing the face value of care at each census time point without accounting for changes in the cost of living. And you can find definition of the real value, the real change, or also you can go here in the box, carers by highest qualification, and wonder, what is level 1 qualification? We explain it for you right here. Same with the employment status. How do we define people who are classified as not in work? What does this mean? And all the information are provided here. So let's go back to understand the picture of unpaid carers. We say that 5 million out of 60 million people are providing care. This care is worth an estimated £162. This represents a 29.3% increase in the real value. So we can see, for example, that of those providing unpaid care, 59 are female, 57 are married, 27.9 are registered disabled. We might wonder in terms of where unpaid care are able to secure employment. Well, according to the statistic here, we can see that the majority of them, 38.8%, secure employment in public admin, education, and health. We can see about the highest qualification achieved. For example, we can see that 17% of those unpaid carers have no qualification. And so we can see a little bit of information about the dashboard. Again, we can select a filter, for example. We can see hours of care, over 50. How many unpaid carers? Well, this is 1.5 million people providing unpaid care in 2021 for over more than 50 hours of care. And 60 of those are female. Now, for time concern, let's just move to the next page. Let's remove all the filter and move to the next page, either here or you click in here. The next page here is the unpaid care page. Now, the unpaid care page provides a more intersectional description of unpaid care, meaning it combines different characteristics. We can analyze those combined characteristics to fully grasp the identity of unpaid carers as far as data allow, of course. And what I found really interesting, for example, just to provide just a few statistics here, we can see this box here, I hope you can see my mouse because I've been assuming you can. But here in the box, hours of care provided per week, we can see that in 2021, those providing unpaid care provide 30% of those provide care for more than 50 hours. Well, let's compare this to 2011. You can see that is 24%. So there has been an increase in the age standardized percentage. So it's not a random percentage, it's a percentage that takes in consideration the aging population and the population size, fully comparable across time. And we can see that it goes from 24 to 30%. So a big increase. Another graph that I found really interesting, for example, is carers registered as disabled. As you can see here, let me show you something. Let's see the proportion if the carer are providing 1 to 19 hours of care. This is 23%. What happens if we consider carers here? 23%. What happens if we consider 20 to 49? Increases to 28%. What happens if we consider instead those providing more than 50 hours? It goes to 35%. There is a link between the disabled status, registering as disabled status, and the hours of care provided. Worth investigating, of course. Let's see, for example, the age of unpaid carers. So if they provide over 50, the majority of those are 65, over 65. So over 65 people are provide 50 hours of care. If we go to 20 to 49, for example, we can see that this is a little bit different. We have the majority of people providing 20 to 49 hours being between 50 to 64. And 1 to 19 hours, again, it changes. I could see in the chat that someone say that the ethnicity of carers are really broad. Well, this is for two main reasons. First, we rely on census data and the way they classify the data. And second, if we go too much into the detail, the data cell will decrease so much that people will be identifiable, especially because you can select sex, you can select local authority, you can select hours of care. And so we cannot allow that. It will be an identification problem. So yeah, that's the main concern. Sorry, I was just spotting the question in the meantime. Yeah, so let's go to the next page, demographics. This page let us explore the demographic characteristic in more detail in terms of marital status, religion, age profile, economic activity, ethnicity, sexual orientation, and what it allows us to do as well, unlike the other two pages, it allows us to compare the part of the population that doesn't provide unpaid care with those who instead provide unpaid care. So I think this is another important element. And for example, let's focus on resident by economic activity. You can see that if we consider the entire population, the active part is 61%. If you then select non-carers, those not providing unpaid care, 62% are active on the labor market. But let's see unpaid carers. If we select 1 to 19, we see the percentage is 69. This is quite something, they can cope with. It allows unpaid carers to actually also be involved in the labor market. But as the time spending caring increases, for example, 20 to 49, the percentage of people who are active on the labor market decreases. It decreases to 54, and then it decreases to 31 if you consider people providing more than 50 hours of care. Let's go to the health page. The health page provides a little bit of a overview on the health status data broken down by sex, age, hours of care. And I think those are really relevant graphs. So for example, let's remove the filter first of all. And you can see this graph here that I think is really important, is health by hours of care. So different colors represent different health status, from good health, dark green, light green, fair health, and then blue, poor health. And here you can see these bar represent those providing 1 to 19 hours of care. This bar represent 20 to 49 hours of care. These over 50, those providing no hours of care, what we define the non-carers. And you can see that of those providing no hours of care, the percentage who reports a poor health is 5.36%. Now, if we instead study 1.19, this goes to 4.26%. But you can see that this percentage increases as the hours of care increase per week. And so if the hours are 20 to 49, the percentage of people caring 20 to 49 reporting poor health goes up to 8%. And then if we consider 50 plus hour of care per week, the percentage of people goes to 12. But we want to know more. We want to know if this varies by sex, for example, and that's why we have this graph. In this graph, we can see the gender in terms of color. So the green light will be female, and while the blue line will be for male carers. And then we have the age. Each single panel of this graph represent the age group, so under 15 years old, 16 to 24 years old, over 65 years old. And then the intensity of care is reported here. So we have 1 to 19 hours of care, and this is what happens to carers aged 50 to 64, providing 1 to 19 hours of care. What happens to 25 to 34 years old, providing 1 to 19, and what happens to under 15. So let's explore this graph, for example, 50 to 64. What you can see here for care provided for 1 to 19 hours per week, we can see that of those carers, female report 3.7% of female report being in poor health versus the 4.1% of male. We have that if they provide 20 to 49 hours of care, 9% of male report poor health compared to 8.5% of female. And if they provide over 50 hours of care per week, 12.7 male and 12.2 female report having poor health. Again, for time concern, move on to the next page, which is our education page. And I think what's really useful here is we provide an overview of what kind of qualification both unpaid carers, but also those not providing unpaid care register, help. And again, if you want to know the definition of what level 1 is, you can find it here in the description box, together with level 2, level 3, and level 4. Now, this graph, for example, this box tell us about the comparison between the local authority that you could select and the national average. For example, let's select Sheffield. And here you can see that there is a comparison with the national average. So in this case, for example, Sheffield takes in consideration has a higher percentage of people with no qualification compared to the national average, a lower percentage of people with level 1 qualification compared to the average, and so far. Let's remove the filter here, and what we can explore is resident by highest qualification. And what I want to focus here is the dark gray box. So if, for example, we consider unpaid carers 1 to 19 hours, we can see that only 9% of those has no qualification. If we consider 20 to 49, this percentage already increased to 19% of people having no qualification. Over 50 hours, well, it goes to 27%. So as you can see, there is something to investigate here, is a link. We don't know the nature of it. We need to do analysis on it. But the dashboard is really good in capturing these little trends that are useful for future research. So let's clean the filter and let's go to the next page, which is the employment page. What I find really useful in this particular page is the last graph, especially. In here, you have different color for the employment status going from unemployed, medium-term unemployed, never worked, short-term unemployed. Again, if you wonder what this means, everything is written here, exactly for the health as well. So a question about what we include for health, you can check all the data description, everything is fully captured in that box. Resident by employment history by hours of care. What is really staggering out of this graph is that let's take in consideration the blue bar, the medium-term unemployed. This goes to 25% for 1 to 19 hours of care, 32% for 20 to 49 hours of care, over 50 hours of care, it goes to 52%. There is a link. The higher the intensity of care provided, the higher the chance of being in a status defined medium-term unemployed. And also, we see the same trend for never worked. So the higher the intensity of care, and of course, the more unpaid care struggle to balance unpaid care with paid work. And there is some kind of link here to be further investigated. Again, also the industry in which they secure employment. This is a nice table, I believe, that provides you the percentage of people that secure employment in this different industry by the hours of care provided. And what you can see that is very clear is that the majority of unpaid carers, no matter the intensity really, secure employment in public admin, education and health, as well as distribution and hospitality, professional real estate and admin. And those are known by the literature to be the more family-friendly, flexible sectors, which might hint us, and we might speculate that the unpredictable demand of unpaid care is really difficult to combine with the fixed schedule work routine. And so those people self-select themselves in more flexible work environment. The last page I'm going to show you today is, if my computer allows, is the compare page. We're really proud of this page because this page emerged directly from our co-design workshop and lets you compare the same district over time or different district over time or the same district in different years. Let me give an example. We can select, for example, Sheffield. Again, and we can double check, for example, the difference between Sheffield in 2021 and Sheffield in 2011. And you can see that, for example, 55% of carers are married in 2021. This percentage goes up to 64% in 2011. But you can do this around the topic of unpaid carers, around the demography, around the health, around the education, or you can do this for employment. Now, let me show you something, for example. When we compare demography of Sheffield in 2021 and 2011, you can see this box becomes red. So, thank you so much, Faye. This box becomes red. And the reason is that we don't have information about this particular variable in 2011. The reason is that this question hasn't been asked in 2011. So you might find some boxes becoming red, whether we don't have information for that particular variable because the question wasn't asked, or whether the data cells are so small that unfortunately the ONS suppressed the data for identification reason. So yeah, we can compare these, or as I say, we can compare 2021, and we want to analyze female versus male. You can do all sorts of playing around with this page. So for time concern, I really want to open the floor to questions and feedback, and very happy to answer all your questions. But first of all, I think, Faye, we agreed that I will share the QR code for you to say some words about how important feedback are for us. So let me do that.
Maria, thank you so much. That was an amazing tour of the dashboard. Thank you so much. It was so thorough, and